They're the thin blue line, charged with protecting the public from harm. But as they go about the daily task of dealing with the worst side of human experience, what harm is being done to the mental health of our police officers? Alan didn't notice his slide into depression.
That's a very fresh-faced Al Phillips.
And thinks police culture played a part in that.
I remember dealing with, sadly, a cot death where a 3-month-old baby had passed away, and I was just told, look, go and have a beer and forget about it. And to be honest with you, you can't forget picking up a little porcelain baby of 3 months that's passed away. You can't forget that.
We asked forces across England and Wales for figures on sickness absence, and the results are shocking. In the last 6 years, the proportion of sick days taken by police officers for mental health problems rose 98%. In other words, it's doubled. By comparison, sickness absence for physical health problems rose 19%.
It's a real high point in my career.
Our figures don't surprise John. His problems began after more than 20 years in the job, rising to the rank of chief superintendent.
I'd seen as much as I could see, and I wasn't able to see any more. And that's the point at which I broke. I certainly know significantly more police officers working under significantly more strain than at any previous point in my career.
Recent events in Manchester and London have underlined the pressure the police find themselves under, and this at a time when officer numbers have fallen, down 10% since 2011, according to our research.
Well, we're seeing a situation where the police service, in terms of threat, in terms of demand, is going through the roof. At a time when we've lost 21,500 officers, the equivalent of 11 whole forces out of 43 have been taking out the system. It's not surprising that those that are at the sharp end of policing are beginning to struggle and finding it difficult to cope.
Our investigation also found 7 years ago just over 2,300 officers took long-term sick leave of a month or more because of their mental health. By last year, that number had risen to more than 3,700. Alan's experience of admitting his depression did not result in the support he needed.
When I finally did disclose that I was unwell, just had some dreadful experiences. Told on one occasion, well, when you're feeling down and thinking of committing suicide, think of your daughters. So my colleagues were brilliant, the force were not.
In response to our findings, the Home Office says that it does recognise the uniquely challenging work of police officers can impact on their mental health. It says it's for police chiefs to ensure that help is in place for those that need it. And in addition, the Home Office recently allocated £7.5 million to set up a new national police welfare service. The question is, will that be enough to reverse the troubling rise in mental health difficulties our figures reveal?
Given what we as a society ask and expect of them, I think they in return are entitled to ask and expect something of us, which is a far greater degree of understanding of the price that some of them pay as a consequence of the work they do.
My opinion is if you have a healthy workforce, you'll actually deal with a lot more crime because there'll be a lot more people at work.
It's 4 months since PC Keith Palmer died protecting Parliament, the most recent reminder of the risks the police face as they protect the public. But it seems increasingly doing their duty is damaging their mental well-being.